us also, viewers in the newsroom. Thank you, Mr. Narayanan, for joining me. And now, viewers, moving on to something more serious. A rare virus scare is now unfolding aboard the Dutch expedition cruise ship MV Hondius. Among those on board are 2 Indian crew members, a development now being closely tracked by Indian health authorities. So far, 3 people have died and 5 cases have now been confirmed, while 3 more remain under suspicion. A third linked case has now emerged in the UK, triggering fresh contact tracing. The ship's voyage has already crossed Argentina, Antarctica, St. Helena, Ascension Island and Cabo Verde, turning this into a multi-country health alert. 1 patient was also evacuated to South Africa, while another infected passenger died after leaving the vessel. The Hantavirus scare closely echoes the early days of COVID-19. A handful of unexplained cases, a confined travel setting, cross-border exposure, and then the race to trace contacts before it spreads wider. Now, this is not COVID, viewers. The World Health Organization says the wider public risk remains low. But Hantavirus is far deadlier. Some strains can kill up to roughly 1 in 3 infected patients. It usually spreads through contact with infected rodent waste. And limited human-to-human transmission has been linked to the Andes strain, now under investigation. For now, the numbers are still small, but as the world learned in 2020, outbreaks often begin with just a few cases. I'd like to welcome my guest now, Dr. Anil Arora is the head of gastroenterology. Dr. P.S. Venkatesh Rao is a senior doctor, and Dr. Ishwar Gilada is an infection specialist. I want to take this question with you, Dr. Ishwar Gilada, because as I was reading and as we've described to our viewers as well, rodent waste, rats, that waste, leaves particles into the air, and that, if inhaled, can cause this infection. Dr. Gilada, please explain that to our viewers. How exactly is this even happening?
See, this is a zoonotic infection, which is a rodent-borne. Initially, it was among rodent to rodent, forest rodent to the domestic rodent. Then it came to the human being. But now, this Andes variety or Andes variant, it can also transmit from human to human. Now, what happens is, when there are some rodents droppings or urine or feces or anything, or saliva, which is dried up, which is lying somewhere, and then you dust and you broom and you inhale that, we can get infected. But here in the MV Hondius ship, it has been transmitted from human to human. So there are 2 aspects of it. One is human to human transmission, which is happening only with Andes. And secondly, Andes virus giving Hunter respiratory syndrome, which is more killer than other syndromes. So it is around 40% death rate. However, the infection rate remains low. That is called R0. That one infected person, how many person can be infected, and that remains low, and therefore it cannot become a pandemic like COVID. Otherwise, it is a health concern and concern for the scientists and the scientific community and governments, but not at all for the common people currently.
Right. I want to go across to Dr. P.S. Venkatesh Rao. Dr. Rao, my question to you is that, I was reading that if, this will spread in a confined space. For example, if there are 2, there's a spouses living together, perhaps in that intimate setting, but this isn't really infectious. What is the line between that, Dr. Rao? Would you explain that?
Good evening. Pardon the last part of your question?
Dr. Rao, I want to understand from you in a very detailed way how this virus really spreads, because according to what I was reading, if you're in an intimate setting, if you're in a confined space with somebody, that's when the virus spreads. Is it different from COVID when it comes to the infection and how it spreads?
See, certain infections, these are all airborne infections we are talking about. That means the spread occurs with the virus spreading through cough droplets or through dust that you inhale into your airways, and then it infects. Now, there are many such viruses and even bacterial infections which spread airborne. How infective they are it depends on the virus's genetic mapping. Like you try to compare it with the coronavirus. The coronavirus had a specific genetic insertion. There were enough evidence that it was a man-made, man-altered virus. It was altered virus, and it had been altered to make it specifically infective to human beings, more than the other SARS viruses from which it had evolved. Now, this hantavirus, except the Andes version, which is seen in Chile and Argentina, is not known to spread easily from one human being to another. It is basically an infection, like Dr. Gilada said, a zoonotic infection which comes from wild rodents, not from the house mouse or the usual house rodents. It is from wild rodents, and it has shown evidence of spread from human to human. Argentina has had 101 cases of hantavirus infections in the last year, and it is estimated that there may be anywhere from 10,000 or more infections, hantavirus infections in Asia itself. If that is the case and there has been no pandemic over the years, it is obvious that this is not as infective from human to human as the coronavirus that you were asking about. Now, we every year have any number of cases of flu, influenza, etc., because those are highly infectious. This is not that infectious to human beings, and this is exactly why the WHO is saying that this may not become an epidemic or a pandemic, because this is not some new virus like the coronavirus. It is some virus which has existed and has been known for nearly 100 years. It was named after the Hantan River of Korea after an outbreak during the Korean War. And so it has been known, it was first identified nearly 100 years ago, and we have had many cases and it has not really spread. So their fear of spread from human to human and causing an epidemic or pandemic is low. But it is a different matter that this virus is very deadly, and hence getting this infection is something to be really concerned about, since we don't have a treatment or even a vaccine against it. So that is the cause of concern, and not the fear that this will become a big pandemic. They are quarantining all these people, and that is the best way of dealing with such viruses for which we don't have any treatment or vaccine, and we can't prevent that infection. And as to confined spaces that you talked about, yes, any confined space, the chances of an airborne infection from one person to another is much higher, and even contact spread, where the person contaminates a door handle or some other object, which we refer to as fomites, and someone else may touch that same thing. So in confined spaces, obviously, if you remember, during the COVID, there were instructions that please don't have large crowds anywhere and don't go to crowded areas. So the idea was to prevent human to human spread. Here the chances are very low, but this being Andes variety of hantavirus, this is the only one which has shown some evidence of spread from human to human. Yes, Vaishali.
Right, Mr. Rao. Now I want to go across to Dr. Anil Arora. He's a guest. He's the head of gastroenterology. Now, Dr. Arora, the question is that which is the body part that this targets? I read about it and it said that it targets the lungs essentially. What would you like to say on that? And the other part is about the symptoms. Are they similar to flu, or somebody can perhaps differentiate between this virus and the regular flu?
Yeah. Thank you, Vishali, for having me on your panel. I think one important question which has been answered both by Dr. Rao and Dr. Ishwar is, by default, this is a virus which has to spread by the airborne route. So airborne route is so important, and it has to be inhaled. So mostly the common symptoms will be like any flu-like illness, like you will have cough, sneezing, cold-like symptoms, and mostly when the disease also spreads to the GI tract, you will have nausea, vomiting, abdominal pain, constipation, or diarrhea. Since the airborne route is most important, so this will present like any flu-like illness, like a common influenza flu, common cold, or even COVID-like symptoms. So it is not possible to distinguish with symptomatology whether you are having a hantavirus or COVID virus or any flu-like illness. It is only because you have been confined to very close spaces. In fact, the ship travel is the ideal place where you have a limited small room, where you have a shared room where somebody is suffering from, say, infection which is rarely seen, like hantavirus. As Dr. Rao said, that this has been discovered almost 100 years ago, and there have been pockets of epidemics or pockets of confined infection all over the world, including Korea, Mexico. In fact, Mexico and China are the most common places where you have large number of the cases. The reason why WHO says that this is not going to be like COVID is by default it causes a high mortality. In fact, if you see out of the 8 cases which have been confirmed to be related to the hantavirus, 3 have already died. So a virus which is going to kill you is not going to spread like COVID. If you remember clearly, it was the second mutation in the COVID virus which was fatal. For virus to spread, it will typically not kill a human being because it wants to survive as much as a human is likely to survive. So it will mutate so that the virus or the virus per se will let the patient survive. It has to multiply. Otherwise, if it kills the patient, so by default, it will not survive. So there is a mutual benefit both for the human being as and as well as the virus to survive. Typical symptoms are just like any symptoms suffering from cold, itching, running of the nose, coughing, and respiratory distress. In fact, the common symptomatology of hantavirus is there are 2 types of syndrome. You have a hantapulmonary syndrome, which is commonly seen in patients who have died in this ship, which had started from the Dutch territory, as well as a new syndrome, which is typically seen in India, called hemorrhagic renal syndrome or HCPF. So common symptoms have to be confirmed by the laboratories whether it is a hantavirus or not. This cannot be done in every case. So this is that we already have 2 patients who on that ship have been Indian and have been exposed to this hantavirus. So you do not keep on trying to settle the infection, trying to investigate the infection to be related to the hantavirus. In fact, there are already around 100 laboratories in India which can go and test. So you have to have a typical epidemiological lab for testing it, or typical epidemiological lab for testing it. The very fact that even WHO has warned that this is not going to be epidemic is because it has a high fatality rate. But we have to tread the path of the caution, because if anybody gets infected, is likely to have a high mortality.
Right. Dr. Gilara, a lot of us have aging parents, and when I read about this virus, I was honestly very worried. Are we looking at something like COVID, which could perhaps come and destroy our peace and peace of mind and our health, or do you think this situation will be controlled?
See, this is all happening because of very, very alert media, and above the media there is a social media. So any information coming from one corner of the world is going to everybody, and people are scared. But unnecessarily getting scared is not going to be a solution. And secondly, human beings, even if they get scared, they do not act. For example, if they are really scared of COVID, and during that period they thought that COVID, we should have our immunity better and we should work on immunity, where are they working? Have the smokers stopped smoking because of COVID? No. So I think these are all momentary things happening. Secondly, hantavirus, as has been said by Dr. Rao, it's quite an old virus. Since 1950 we know, but it has been existed even before that. If you talk about the numbers, China itself had more than 15 lakh cases from 1950 to 2007. More than 50,000 people died. But it is not so common in India. And in China, even they eat rats. So basically it depends on habitats and how we intrude the habitats of wild animal, how we intrude the habitats of ecology. Now what is happening is human being, we are so selfish. For our survival, we want to eat everything in the world, whatever is available. Then we want to habitat everything. We go to in forest, we want to have a 5-star hotel in forest. We try to play with animals there. We try to play with birds there. They are going to attack you. So basically what is happening currently in last 40 years, most infections are viral. Because for bacteria, we have antibacterial, for parasite, we have antiparasite, for fungus, we have antifungal. But there are no effective antivirals. And therefore, most infections, most epidemics are viral. Among them, 70% of them are zoonotic infections coming from animal to human being or bird to human being. You talk about HIV, you talk about mpox or monkeypox, you talk about SARS, mad cow disease, bird flu, Nipah, Zika, Ebola, all are animal-borne infections. But we are not improving. Everything comes, we just talk about it 10 days, 20 days and forget about it. So I think we need to, two things. One is immediate thing, what is to be done. Secondly, long run, we must have a good strategy. So India has done one good thing that, or India and most countries, we have pandemic preparedness. And because of COVID, at the time of when the COVID began, we had only 50 labs in the entire country of 1.5 million people which could test COVID. And then within just 6 to 8 months time, every locality had 50 labs. So we had, what a big country like India had 50 labs, and each locality, each township had a 50 labs. So we could expand our horizon to test like that. Same thing can
Mr.
be done
Gilada, I
in
just quickly want to interrupt you. We're very short on time. We only have 1 minute left on this debate. But Mr. Rao, I want your opinion on this, because this sounds a little odd, on a ship, animal waste is, this virus happens because rodent droppings are there everywhere around us. So it just kind of confuses a person a little bit. But I want to understand from you, Dr. Rao, should we be worried, and what are the precautions?
See, as I said earlier, these it is the wild rodents which are carrying this virus, not the house mouse or the usual domestic this thing. Secondly, it has been repeatedly mentioned in connection with Hanta and such viruses that if you are cleaning up a dirty place which may have the excreta of these kind of wild animals, for heaven's sake, don't sweep and raise the dust. Don't use a vacuum cleaner, which may also allow the virus to go through its filter. Please use either a disinfectant or a bleach, and do wet cleaning after wearing a mask, N95 mask, and wearing gloves and a protective dress. You can't take these things casually. And as far as these wild animals are concerned, like Professor Gilada said, you can't go around hunting and playing around with all these and exposing yourself to them. There are millions of viruses which we still don't know, which we have not identified, which are there in the wild. So best is take protection. Don't honestly go and fiddle around with all wild animals and try to eat them and try to have them in a zoo or something else. And be careful with this. You never know what kind of viruses are going to hit you, and what will be the end result. As far as this Hantavirus is concerned, the instructions are very clear. Anywhere which is dirty, dusty, please don't raise the dust, and use brooms and vacuum cleaners. Do a wet cleaning using disinfectants and bleach. Yes, Vaishali.
Absolutely, Mr. Rao. This is very, very important advice that you've given, and I hope our viewers make a note of it. And for all those experimental non-vegetarians, animal meat may not indeed be that safe. With that, I'd like to thank all our panelists, our esteemed panelists, for joining me on the broadcast. Dr. Anil Arora, Dr. Rao, Dr. Gilada, thank you for your viewpoint on this deadly virus. And with that, viewers, it's time for a short commercial break. Thank you so much for watching, and stay with us.
अगर आप नहीं रहे तो ना ये